Thank you all for being here today to train to be a volunteer support woman for our Pregnant with Cancer Network. I am Patty Murray, one of the co-founders of our organization and one of the original support women. What gives me a great sense of pride, aside from being a mom, is to be a current support woman for this network. Thank you also for your willingness to share your experiences with all these other women. It is this passion that allows Pregnant with Cancer to exist. It is our intent and hope that this training makes you feel confidently equipped to offer the hope and support to other women who are diagnosed with cancer while pregnant. Just a brief history of our group. The Pregnant with Cancer is a national not-for-profit organization created by myself and 2 other women to offer hope and support to women being diagnosed with cancer while pregnant.
Today, we help women from across the United States and in many countries throughout the world.
It is our mission to let women know that they're not alone. Being diagnosed with cancer when you're pregnant can be terrifying and lonely. You may feel like you're the only pregnant woman ever to be given such terrifying and devastating news. So we have set up a network of hundreds of women from across the United States who were once given a similar diagnosis. This volunteer woman can lend support, offer hope, and share her experiences.
Now we will cover your role as a H42 volunteer support woman. First, we will need to go over the process of matching a newly diagnosed woman. What happens is new members contact H42 to request support via our website at www.hope42.org or by phoning 1-800-743-4471. Hope42's patient coordinator then contacts the new member to let them know we will research a volunteer support woman from the network to connect with them based upon the information they provided. We reach out to a volunteer support woman either by phone or email and ask if it is currently a good time to support a new member. Once a volunteer support woman responds positively, our patient coordinator provides the new member and the volunteer support woman with each other's contact information, typically via email. This consists of name, phone number, email address, and home state or country if overseas. Now this is where your vitally important role begins. As the volunteer support woman, we ask that you initiate the first contact with your new member, either by phone or email, depending on the preference of the new member. Please try your best to do this within 24 hours of receiving her information. As contact is established, the new member and the volunteer support woman can determine the new contact, how often to contact, possibly arranging the next phone call, or plan to email one another. So when do you typically support a new member? New members are typically content with support through the birth of their baby and throughout their treatment. It is our hope that the support is maintained in this time period. Often, many of our members continue to maintain friendships with ladies they have supported. The 2 of you can determine how much support is sufficient and the time frame desired. What is your best tool to use while supporting? Your personal experience is what best equips you to be a supporter. We encourage you to share your experience and provide a listening ear. It may be helpful to say things such as, "This was my experience," or you can describe how you felt during your testing and/or treatment. It is important to remember not to offer medical advice. What if the new member is looking for answers to medical questions or medical advice? Medical advice is available for members with questions. In the initial letter we will send to our new members, we provide information about Dr. Elise Kardanik, a maternal fetal medicine specialist with vast experience with pregnancy and cancer, as a resource for members' medical questions. We also offer information about the Cancer and Pregnancy Registry maintained by this Dr. Kardanik. Members can always be directed to our website at www.hope42.org for further information about registry and additional resources. Many volunteer support women wonder how many women they will be asked to support at any one given time. We strive to limit support situations to approximately no more than 1 request per 6 months. When a request to support is made, please do not hesitate to let us know if it is not a good time to do so. We will simply add you back on our list of available supporters for a future date. If any issues arise, please contact us. They occur infrequently, but if they do, we can rectify the situation. And if for any reason a volunteer support woman deems the member's request for support is too great or finds that there is an issue, volunteer support women are encouraged to connect with Hope for Two for guidance. The patient coordinator can then assist and intervene as necessary. Also, if any issues or events occur in your private life that would prevent you from supporting, please contact us and we will find the new member a new support woman.
Ladies, please note that your personal experience is what best equips you to be one of our volunteer support women. What's best for you to do is to lend a listening ear, to share your experiences. What we do not want you to do is to provide any counseling at all or to problem solve. Before I introduce you to two of the specialists that we have here tonight that will help you to make that distinction, I will go through our first role play. And that role play will be an initial conversation that the volunteer support woman will have with the newly diagnosed mom-to-be. Hi, Kelly. I'm Patty Murray. I'm from the Pregnant with Cancer Network, and I was assigned to be one of your support women during your pregnancy. Is this a good time to talk to you right now?
Great. Thank you so much for calling.
This first time that we talk, I would really like to get to know a little bit about you, your story, and some of your treatments that you're having, some of your cares and concerns. But before we even get into that, Kelly, I'm just going to tell you just a quick bit about me. Mm-hmm. So you just can know a little bit more about me, okay, before you go into your story. I was diagnosed at 35 when I was pregnant with my third child. At the time, I had two children, ages 2 and 4, and I went through surgery and some treatments during my pregnancy, and then I had some treatments afterwards. But right now, I can tell you that I'm cancer-free, very, very healthy, and so is my son. He's doing all the things that kids of his age are doing. He's playing basketball and baseball.
You know, that's such a great relief to hear, especially knowing that he's doing so well. Yeah. And how are you feeling?
I'm feeling wonderful. Of course, I go through all my checkups, but every single time I get the green light from my doctors, and that's just, you know, it encourages me to keep on going. And it's wonderful to be able to talk to you here today. Can you tell me a little bit about your story?
Well, I was just diagnosed. I am about 4 months pregnant with my second child. I have a 2-year-old at home as well. My husband and I have been married 4 years. We actually, found a lump in my neck quite by accident. It was our 4-year anniversary, and we were out, and my mother actually happened to notice a lump. I ignored it, and I would say it was a week later or so when I really noticed it just looked very large. So I did contact a doctor. Within 6 weeks of that, I was finally diagnosed with Hodgkin's disease. They did stage me as far as they could, being that I was pregnant. They couldn't do all the testing. So I'm not sure of all of the testing that I'm going to have to go through once the baby's born. But right now they're saying that I'm stage 2 and it's a bulky cancer. And I start my first treatment.
That's what I was just going to ask you.
Okay.
What's the next step in your treatment?
I just had the Mediport put in, and my first treatment will be January 2nd. And that's my first chemo treatment, and they said that they were going to keep me overnight. I guess it was just to watch me and see how the baby is and how I take to the chemo and that. But it's scary. I'm really scared for myself and for the baby, and I wonder if this is the right choice to go through the chemo.
This is very, very important that you're voicing this concern to me and your fears. I've gone through so many of the stages you'll be going through, the initial shock, the fear, the concern. You had a question about a medical question. We could give you a name of a doctor that could answer some of the questions that you might have of the medical questions. But I can tell you about people that I know that have had the same type of treatment and that have been pregnant, and I can tell you about their experiences and how we can get into that a little bit later.
Okay.
If that'd be helpful.
That would. It definitely would.
Is there anybody that goes with you to any of the doctor's visits?
My husband has been going, and we have, a lot of friends and family that will take Jake, my 2-year-old.
Yeah, that's so important. I just want to make sure you have like a support network.
I do. Thank you. I do.
Because your first priority is to take care of yourself and to get better. And a lot of times you might feel real strong and independent, and you can take care of this yourself. But any offer of help, to take advantage of it.
Right.
Not, I don't mean that, don't take advantage of it, but just,
It's so tough because I wanna do it all, and it's scary because it's almost like I have to back off, and I'm almost afraid of that too.
it is very scary, but we're here, and we have hundreds of women that have gone down that road, myself and so many others, and they're healthy. We have a woman in our network that she's been out 20 years, and she's just doing great.
Oh, that is awesome. That's very good. It's nice to hear that. It's a great relief and sense of hope from myself and my family and our baby.
I have a picture of my son that I could show you.
I would love it.
You
I would
know,
love it.
Some people have used that picture and they put it up on their refrigerator. And of course, if you have any concerns or fears, in between our phone calls, please feel free to give me a call. Okay. A lot of times that visual of seeing that baby,
Right.
that has a normal face and he has 10 fingers and 10
Right.
toes.
Right.
It's so
That's great.
hopeful.
Thank you.
But I was wondering about your next doctor visit, how to set up a time to speak with each other next.
Okay.
Sometimes people want to talk like a day before their next visit or a couple days later. What would be best for you think?
How about, do you think that I can call you maybe the night before if I'm feeling, really anxious before I go into the hospital in the morning?
What's the best time for you?
Probably around 8 o'clock or so. It's usually around Jake's bedtime and he'll be in bed.
Me too, because my children are usually in bed or getting ready for bed, and
Okay.
I have the free time.
Okay.
So what day is that then?
Great. That would be Tuesday.
Okay, so I'll put it down on my calendar that
Okay.
you'll give me a call then?
Absolutely.
Okay.
Thank you so
Wonderful.
much.
But please, if you have any questions in between now and then, give me a call.
Okay.
You'll never be a bother at all.
Great.
Okay?
Thank you so much, Patty. I appreciate
I
the
look forward
call.
to talking to you next,
Okay.
Kelly.
Great. Thanks.
We have two specialists here today to help you make the distinction I mentioned, the distinction between what we have to offer, a listening ear, hope and support that you can provide to these women, and professional counseling and problem solving. They will also help to train you on how to best offer the hope and support to women facing cancer while pregnant. Please allow me to introduce you to these two ladies who both serve on our board of professional advisors at the Pregnant with Cancer Network. These two women are Christine Bialuski and Jolie Giardino. Let me tell you a little bit about Jolie. Jolie is a clinical coordinator for a human services agency located in Western New York. She has her bachelor's and master's degree in social work. She is currently employed as a clinical social worker providing individual, couple, and group therapy. Her clinical specialty is in the treatment of women struggling with self-esteem issues. She is also a certified substance abuse professional and a co-author of a book, When a Loved One is Hospitalized, A Family's Guide. As a licensed clinical social worker, Christine Bialuski provides psychotherapy to individuals and families affected by chronic medical illness. Her specialty is cancer. She has had extensive training in grief counseling for those individuals who may have lost a loved one as a result of a medical condition or trauma, such as sudden death. She has been practicing for 24 years and has been a clinical assistant professor at SUNY at Buffalo, Graduate School of Social Work, for the last 8 years.
We're going to be speaking about a number of skills which are important in terms of helping you be the best support person that you can be. And initially, we're going to be speaking about active listening skills. There are a number of listening skills that we all use that enhance communication, and they allow the person to whom you're speaking to feel heard and supported. And there are 4 specific strategies that you can utilize to improve communication and to promote active listening. The first skill is called clarification. Clarification is used to encourage the speaker to elaborate, and it offers you as the listener the opportunity to check out the accuracy of what you've heard or to clear up a vague or confusing matter. An example of clarification might be if you said, "Do you mean that?" or "Are you saying that?" The second skill is called paraphrasing. And when we paraphrase, we are really rephrasing the content of what we have just heard. And it helps the patient, it helps the mom-to-be to focus on the content of what she's saying. The third active listening skill is called reflection. And this is where the support person responds to the feeling content of what she has heard. And it encourages the mom-to-be to express her feelings about a particular issue that she has been speaking about. And it helps her to become more aware of her own feelings. And then lastly, summarization. Summarization means that we help the mom-to-be to pull together what her thoughts and feelings are, and we repeat back to her what we believe we've heard and also how we think she may be feeling. So we're tying together multiple elements of the messages that we have heard from the mom-to-be. And it helps also to identify a common theme. Perhaps she was talking about her anxiety with regard to a doctor's appointment, and we can bring that out for her and then give her some suggestions on how to deal with that feeling. Lastly, we talk about normalizing for the mom-to-be the various feelings that she is experiencing. And the way to do that is to say to her something along the lines of, everybody has bad days. I know it's hard to believe, but you will have a good day again.
Some suggestions to let the mom-to-be know that you are listening may be something as simple and as brief as, "Oh, I see. Tell me more. I'm not sure I understand. Can you tell me another way? Let me see if I understand you correctly. You need this, or you would like this." You may say something like, "I'm sorry you are struggling today. And right now you are not alone. I am in this moment with you. I don't know how this is all going to turn out, but right this second you are okay."
Now, to help you start the conversation with the mom-to-be, we'll talk about some open-ended questions. Open-ended questions are a way to generate conversation and sharing. It also provides an opportunity for mom to move the conversations that are important for her. And by asking open-ended questions, it's more likely to reveal the individual's real concerns and feelings. So here are some examples of open-ended questions that you might want to start with. What are you doing to take care of yourself? How are you doing today? What helps you get through the day? What advice have you received? What kind of support do you need? Tell me about your doctor's visit. What concerns you most?
Another kind of question is something called a closed-ended question. And this is another way to help people focus, to help organize their thoughts, and also a way to sort of gather specific information or facts. A couple of examples might be, what stage of pregnancy are you? What action or steps have you taken so far? What did the doctor say today? These kinds of closed-ended questions, again, just generate information and sometimes organize people's thoughts.
One of the more challenging dimensions to being an active listener is skillfully ending a conversation without feeling abrupt. And here are some ideas about how to do that. You might say, "I'm going to let you go now." Or, "I know talking can be tiring, so I'll let you get your rest." When should we set up to talk again? We've talked about a lot of issues. Let's stop now so you can take some time to digest it. This conversation has been pretty intense. Let's stop so you can take a break. I can talk for 5 more minutes and then I have to go.
And now what we're going to do is just show you a role play about how one might handle a conversation when someone is a little reluctant to get off the phone.
Kelly, I really have to be getting off the phone right now. My daughter I have to take her to her baseball game.
Oh, what do you mean you have to go?
I really think that we've been on the phone for enough time right now, and we can maybe set aside a time to talk next week.
Patty, I'm just feeling so alone right now.
Oh, Kelly, I really feel for you right now, but it's really time for me to get off the phone.
couldn't we just talk a few more minutes just to make me feel a little safer and feel okay before hanging up?
Kelly, I really enjoyed our conversation. I think we've gone enough for this time period today.
Oh, you know what I remembered? I remembered something I did forget to tell you earlier.
I think, you know what I'm going to do? Why don't you tell me what is it about? Anything in particular? What I'm going to do, I think we're going to end the phone conversation right now, and I'll jot it down that you really had something important to say. Maybe you should jot it down.
Do you think we can talk tomorrow?
No, I'm sorry, Kelly. What I think we should do is just get off the phone, and you should, get off the phone and take a deep breath. And I really look forward to talking to you next week, Tuesday, okay?
All right, thanks, Patty.
Okay.
One of the more important aspects of being a support person is to be clear on the boundaries of both the relationship and the type of contact that you're going to have with the mom-to-be. When both the supporter and the mom-to-be know what to expect from the initial contact and future contacts, we refer to this as a boundary. How do boundaries contribute to effective communication, and why are they important? Well, first of all, effective communication has a beginning, a middle, and an end. Staying online or on the phone too long is ineffective, and we all need time to process what has been discussed. And also, boundaries engender healthy relationships. It also addresses expectations. In other words, it defines the contract between the support person and the mom-to-be. And it can also help to avoid disappointments on both sides. Perseveration can dig a person in. That is when a person repeats themselves over and over in the conversation. You want to stop as soon as you hear this happening, because it will not yield more information and in fact may frustrate you as well as the mom-to-be. This moves us to the idea of how frequently would you be calling the mom-to-be? Well, this is determined by a number of factors. One might be whether or not they're in crisis and how long this crisis lasts. Again, what type of cancer the mom-to-be has been diagnosed with and what stage of cancer it is. Those are important pieces of information that you'd want to glean in your initial contact. So you might agree to speak a couple of times or communicate online more frequently if the mom-to-be is in crisis. And again, I said online or by phone. That's part of your initial contract. What is going to be the best mode for you? If you are going to be phone calling, one important tip is to be aware of the time zones. Make sure to set the parameters of your relationship and your contact with the mom-to-be in the initial contact. And it's important to remember, what is your purpose? Your purpose is to support the mom-to-be during the pregnancy. If you wish, after 1 month after delivery, you could say, well, I will let know Pregnant with Cancer Network that you have delivered. And so they understand that the relationship is now going to come to an end. And it's very important for you as a support person to know that even though the relationship with the mom-to-be has ended, the mom will stay in contact with the Pregnant with Cancer Network database, and she'll receive newsletters and mailings, and will be contacted 1 year later to see how she is doing and to ask if she'd like to be a support person at this point. One other small item that you might want to remember, after you've spoken with your mom-to-be, jot down a few notes. It'll help you when you make your next contact.
As we talk about boundaries, one of the things that's important for you to be aware of is something called re-traumatization. This is what happens to a support person when unexpected feelings and perhaps intense feelings come up around contacts with the mom-to-be. A trauma is an experience that produces psychological injury or pain. Being re-traumatized is re-experiencing the psychological pain caused by a previous event, which is usually brought on by a similar event. Now, the important thing for you to be aware of is that being diagnosed with and having someone tell you you have cancer is a trauma, and we need to be respectful of that. Now, re-traumatization may depend on how well one coped with the previous trauma, how recent it was. For instance, people who are chemo coaches are not allowed to be chemo coaches until they're at least 3 years out. For this reason, it's too new. There's physical wounds and there's emotional wounds, and they need time to heal. Also, the length or the severity of the trauma may impact it. So as a support woman, how would you know if you're being re-traumatized? Well, you may lose focus. You may have difficulty concentrating. You may be experiencing body feelings, such as a tightness in the chest, some sort of feeling something like anxiety. You might be overcompensating, keeping busy to avoid feelings. Maybe what you're doing is avoiding the call. You know that you have to make the call, but you keep busy and you keep finding other things to do to avoid the call, or you don't check your email. These are also maybe some things. You may find yourself feeling weepy for no reason, or irritable. Now, certainly these can all be attributed to many other things as well. But if you're finding that many of these things are occurring, it may very well be because you are feeling some re-traumatization. What you can do at this point that is most healthy for you is probably to step back. Take a break. Give the Pregnant with Cancer Network a call and let them know that you just need to take a little breather and sort things out. These are intense emotions, and you're dealing with people who are certainly at difficult times in their lives. So sometimes just taking a break may be helpful. A wonderful resource for medical questions is Dr. Elise Cardonic, who is an OBGYN specializing in treating women with cancer. She is an advisory board member of the Pregnant with Cancer Network, and she can be emailed or contacted by phone. Again, that number will be given to you at the end. Also, there are other resources such as the Oncoline website, the American Cancer Society at their toll-free number, and you can also get specific information on your specific kind of cancer. Encourage the person to focus on living, not statistics. Focus on getting well. Outlook equals outcome. A positive attitude will be an important part of this.
So, as we're wrapping up, we want to emphasize the point that please feel free to call the Pregnant with Cancer Network at any time should you have any questions. We're here to help you. We're here to support you. And as mentioned earlier, there certainly is a great sense of joy when we're helping someone, and we're hoping that as you walk through this journey with moms-to-be, that you can share with them the benefit of your experiences.
Thank you very much, Chris and Jolie, for your time today to train and for your expertise and knowledge. It's truly invaluable. Thank you all, the women in the audience, and for viewing the tape, for taking the time to train with us. As I stated earlier, before, you are the foundation of Pregnant with Cancer. Each time I meet one of you, truly I am amazed by your strength, by your compassion, by your commitment, by your willingness to share your experiences. So many of you have shared the same feeling I had after I went through the cancer experience. I would ask myself over and over, why did this happen to me? Finally, about a year later, when it was all over, I finally realized I had to go through this so I could help other women that have gone through this. Each time I help another woman, I feel a tremendous sense of joy come over me. Someone recently explained to me what that sense of joy is. They put the name serotonin. It's the hormone, the happy hormone, they said. I don't really care what you call it. The joy is real. Your help is real. And it will have a great impact on the lives of the women that you support.
Your feedback is always welcome, encouraged, and greatly appreciated. Feel free to contact us with any updates regarding connecting with your new member or questions or concerns you may have at info@hope42.org, by phone at 1-800-743-4471, or through our website contact form at www.hope42.org. Our patient coordinator will then respond to you promptly. Also, please contact us after the new mom delivers her baby. We would like to know the name, weight, month, and year of birth of the baby, so we can then put the joyous news in our upcoming newsletter under birth announcements. Your willingness to share your experience as a volunteer support woman for Hope for Two is greatly appreciated. Thank you for your time and effort to serve in this way.